Well, there's been a lot of work done trying to figure out how common autism really is. The most recent figures coming out from the Center for Disease Control in the US suggests about 1 in 88, with slightly higher numbers in boys and slightly lower in girls.
You know, I think early detection is important for a number of reasons. Even though parents are picking up on these first signs, almost invariably by the second birthday, the average age of diagnosis remains around the age of 4. So there's a really significant gap.
If everybody recognizes those signs and starts to intervene, our hope would be that a significant percentage of those children would not go on to have a full diagnosis of autism or of any autism spectrum disorder. We don't know yet what those numbers will be, and it may well be that the best we can do so far is at least a change to a less severe category for a very significant percentage. The other problem is that once you've had a diagnosis given, there's often a long wait, in some areas from 2 to 4 years before you get any really intensive intervention. The next question is, while you wait, if it's 2 years to wait for the provincial program, what kind of insurance policies do you have? What kind of money do you have kind of available that you could spend on private therapy? So unfortunately right now, in that waiting game particularly, we have a 2-tiered system. And the more disadvantaged you are, the more disadvantaged you will become and your child will become.
We're seeing that the only difference between an individual spending the rest of their life drugged up in a group home living off welfare, or that same person having a happy and successful life, the only difference between those two things is simply the net worth of their parents.
So obviously the intervention has to be incorporated into community centers, daycare centers, junior and senior kindergarten, and all the way through the education system. So what we need is an integrated service system that will meet the need of the child once the need is identified. And we don't have that kind of integrated system of care the way we would have, say, for, in many areas, childhood diabetes or childhood cancers. Once you get a diagnosis of autism, it's not very likely to go away. It may get better, but it doesn't usually go away. And depending on different stages of changes in their environment, changes in their development, crises will keep coming up and parents need somewhere to go back to.
I think the other major challenge that's yet to be addressed is what do we do beyond the preschool period or even the school age years? I mean, how do we support adolescents and adults with autism to help them, help them reach their potential and lead fulfilling lives?
Hypothetically, if you were to have 2 identical kids with autism, the difference between one of them spiraling downwards into stress, depression, emotional trauma, and living for the rest of their life in an institute, and between the other identical kid becoming incredibly successful, having great social relationships, and potentially even having a great career in the future, the main difference between those two things is the skill of that child's advocate.
Ironically, often the parents who are most capable of searching out the services and getting the money to purchase the services themselves are the ones that will access somebody who will work as case manager. And the people that are less good at advocating will miss out on both having a case manager situation and in getting to the services that would really help their child. And if you don't speak English and you have other cultural differences, it's even harder.
The school system was obviously not designed for somebody with an ASD spectrum disorder to navigate their way through. It's been designed for neurotypicals, people who don't have communication disorders. I think one of the main factors that can influence a downward spiral is stress. Having to go through the stress of navigating through a very unhospitable school environment will cause a lot of stress. And when it gets to a certain point, that stress can become completely incapacitating and can cause the individual to shut down completely.
It's terribly important to choose the right environment, to have the right supports in place. And for many parents, particularly parents that are coming from a more disadvantaged perspective, It's almost an impossible task to be able to go in and talk to a school team that can sometimes be intimidating, and really try to advocate for what they are aware their child needs. Other parents don't even know what to ask for, and so they're totally at the mercy of the system, and that can be wonderful or it can be terrible.
The Canadian Charter of Human Rights and Freedoms even specifies that according to law, every single Canadian citizen has access to equal rights, including people with disabilities. Autism is a disability, ASD spectrum disorders are a disability, and that's why we require the accommodations that we do. That's what we need to be able to succeed the same way that other students are able to without these accommodations. It's simply leveling the playing field and bringing us to a place where we can try and enjoy the same success that other people who do not have ASD are.
I think we have a huge problem in terms of understanding effective transition from high school, whether it's into postgraduate education or whether it's directly into vocational placements. We have not had a focus on it. We don't have any service that's committed to it. The developmental services don't take on the children who may have a few splinter skills that are up into the average range. Many people don't understand the unique environments for learning or for vocations that many of our children, whether they're high-functioning Asperger's or autism spectrum disorder, they're all going to be in that one term. We just don't know what works for so many of them. I think we're at a time where we're starting to focus on it, but we really need a service system that's focusing on it so that appropriate choices can be made. Because if you have a bad vocational experience, it's much harder to go to your next one. The other big piece that's missing for the transition to adulthood is any kind of medical care, because many children and adults with autism have severe ongoing sleep problems, they have severe ongoing anxiety problems, at least a half have mental health problems, and it's very, very difficult to access those services. And most physicians, because it's really family physicians that carry the ball in terms of medical care, have not been trained about the unique problems in autism, the gastrointestinal problems, irritable bowel, gastrointestinal reflux, so many of the food sensitivities and things that cause so much grief on a day-to-day basis are not understood by a large part of the medical community, and they're not therefore comfortable to take adults on into their practice. There are costs at many levels if you're not giving the adult supports. Many parents who managed to hold down 2 jobs to pay for services that children were growing up are now finding that because their young adult cannot find an appropriate community place to work and feel good about themselves in, because that young adult then has to stay at home, one or other parent at that point in life, when they should be feeling perhaps a bit more financially stable, has to give up a job, and so the family has to keep going on one income. So that has ramifications in terms of the workforce, in terms of the quality of life for families, the financial health of families, the fact that it's very stressful to have an adult just sitting around home not doing anything, and all the interactions that come from that. So there are many costs for society for that lack of appropriate planning. There are huge gaps in the adult service system, and many people by default are either just sitting at home, or particularly if they have difficult behavior or explosive behavior, going into some kind of long-term care institutions, many times not in any way the appropriate setting.
The ASD community makes up a very large piece of a population, and it's a growing piece of a population. If we fail to accommodate this very large demographic, we're going to find ourselves with a very eroded workforce, with a very high number of people living off of social welfare or in assisted group homes.
I think there's tremendous human capital among the community of people with autism. I think we hear stories every day about sort of the contributions that people with autism can make. And I think sometimes sort of people point to particularly exceptional or high-functioning individuals with autism, but really individuals across the spectrum can really contribute. They can contribute to the workforce. They contribute to the social lives of their extended communities. But it's not only about human capital or return on investment. I think it ultimately becomes an issue of dignity and social justice. And as members of society, people of autism deserve to find their ways in the world and to have the experience of contributing, to have that sense of pride in participating in the workforce, to have opportunities to further their education, and ultimately live independent lives, with the supports that they need.
One of the most important steps that society can take to begin fixing this very fractured system of support is to try and streamline the system across all different levels. It's very difficult to get the support you need right now in our fractured system.
I think that we really need to get all the people who have expertise in autism and are involved in the autism service system to be working together so that we really work toward an integrated network of care that families can access right from the time of diagnosis right through adulthood. I think that would really be more likely to happen if we had a national autism agenda, so that we've had many meetings at a federal level and interprovincial meetings talking about the needs for the autism community. But I think we need federal and provincial support, that there should be an integrated continuum of care and services. If we had that, then I think we could really look at how could we integrate the current services in a more effective way with cost sharing, and really see if we could do a far better job even if there weren't a lot of extra resources added, although there certainly is money that's needed very specifically at certain times in the early intervention and particularly in the transition into adult services.